Do you have a knee pain or stiffness and wonder, could it be osteoarthritis? You're in the right place because this video is just for you. In this video I'll share 5 key things everyone with the knee osteoarthritis should know. You'll gain understanding what actually happens in osteoarthritis, why pain doesn't always reflect to the condition of the knee, and what you can start by doing today to feel yourself better. Many people are afraid that using their knees will wear them out, but research shows the opposite. Movement is the best medicine for your knees, and let's look at why. Main content: 5 things. Osteoarthritis is a process, not an end point. Your body is constantly changing as the old cells are replaced with the new ones. Cartilage, bone, joint ligaments, muscles and nerve adapt to the new life and movement. These changes can be helpful, for example when you are doing the training, but some changes can be linked with the pain, stiffness or swelling. Somebody gets gray hair, somebody gets wrinkled while they get aged. But is the aging equals the joint pain? You will going to figure it out soon. Osteoarthritis is a term what is used to describe the changes in the joints. Changes in the knee, cartilage and joint surfaces happen, but these are only part of the story. Most what you see and feel is due to the changes of tissue around your knee and how your brain and body responds to it. Osteoarthritis is not something what happens suddenly, but rather a process, and it has been going on for a long time. Changes in the knee have been way more longer that you have noticed the pain. Osteoarthritis changes are more often painful in people who have less active, are overweighted and who have old injuries. It's not that true that everyone gets osteoarthritis as they get older, and it's not true that osteoarthritis always gets worse with age. What has affected on your knee so far is not the most important thing. What matters is that there are many things what you can do to improve your joint health, how it feels and how well you can take the part in life. Pain does not equal the knee damage. There is a lot more than your knee than just the cartilage. It's important to also think about the muscle, tendon, bones, joint lining and joint fluids and ligaments and nerve. When we check this picture, there is this anterior and posterior thigh muscles what control the knee. There is this thigh bone, there is this tibia bone and there is this kneecap, and they are all connected together with the cartilage surface. In that area there is also tendons what move the bone, joint fluids inside the knee. There is ligaments what holds the bones together, joint lining making the joint fluid, and there is the place where the friction comes, and nerve takes information between your brain and the body. Muscles move the joints. Movement is the medicine for your knee. And you don't damage your knees by moving. It's the opposite. There are always ways you can manage to use your joints so that you will going to get the best response. It's helpful to design the plan what's right for you. If you have other health conditions, speak to your general professor or nurse. If you are not sure what exercises you should do, ask physio for the advice. We will going to get those exercises later. The body doesn't like rapid changes and your knee is no different. This means that the knee will respond to the best gradual changes in use. If you want to start new activity or increase how much you are doing in certain activities, it's best to start with the low level and build over up in time. People often think that cartilage is a shock absorber for the joints, but muscles are way better in absorbing the shock. Muscles tends to help to cushion the load of your knee so that you can do more with hurt less. More you move your knees, the more free it will be. When you get more movement, it means that you will going to have more options for what you can do. So aim to move your joints as much as you can. You have been told to pace yourself. Spreading out the things what use the joint over the day rather than doing them all in once is best for your knee. Why we need to do exercises for certain muscles? Bottom or glutes will going to push your thigh back and out. Hamstrings will going to be bending the knee, and thigh, so meaning quadriceps, will going to be straightening the knee. Also, it's important to do some sort of maintenance or exercises for the calves and shins because they pushes the heel off from the ground and it makes it easier to move. In physical activities, you can walk, you can dance, you can run, you can swim, you can cycle or do whatever you want to. If you increase the pain for the next night, then dial downwards a bit and then you are going good. Let's tackle a few myths and misconceptions about the knee osteoarthritis. It can only get worse from here. Research shows that people who have osteoarthritis can improve the health and function of the joints. They can also improve how they feel and what they are able to do, so not all osteoarthritis gets worse over time. My pen tells me how damaged my joint is. Pain levels and joint changes often relate poorly to each other. No two people are not the same, and pain is influenced by much more than just your knee. I've worn out my joint. Changes in the cartilage thickness is one part of the osteoarthritis, but these changes is not simply due to using the joint. What's more, pain or noise such as grinding are due to the many factors other than cartilage and bones. Using the joint is the best thing what you can do. It's better to be careful so I don't wear out my knee. That is one thing what you need to be least thinking about because the joints are meant for use. If we drop all the exercises off and we just lay passive, that is the way we can get ourselves into really difficult situations. So use the joints. If you end up having the surgery, hip and knee osteoarthritis are the most common surgeries in the whole world. So don't be worrying about that. Use your body. Osteoarthritis always gets worse with age. Research shows that osteoarthritis can stay the same over long periods of time and the symptoms can also improve. Having osteoarthritis means that I will going to need the joint replacement. Joint replacement is only one option for some people with the osteoarthritis. You can do the things what will going to decrease your chances and needing for the surgery. Only small portion of the people with the osteoarthritis need surgery. You can influence your future. These are the structures what you need to also notice. That eating is for health. Eating well is great for your whole health as well as your knee health. This is because the foods are good for your heart and brains and also good for the muscles and joints. When you are eating well, you are making sure that your body can perform at the well and you can feel your best. Something concerning about the weight. Weight loss may improve the joint pain, but the key thing is to focus on the healthy habits and the ways that you can keep them doing those. You don't need to be a certain size to improve your health and well-being. Healthy habits are great for all bodies. It's important to have a good night's sleep because sleeping affects all aspects of your health, including knee pain. Poor sleep can make your knee pain go worse, and there are many things what you can do to improve your sleep. A few changes to your daily routines can have a large effect. Pain can also affect sleeping. If your knee pain is having an impact on your sleep, this may be a good time to seek further support. What you need to remember from this video? Osteoarthritis is a process. Pain doesn't tell you the whole story. Movement is the medicine, myths can be ignored, and you always have the power to influence your own well-being. If you want to find easy ways how to do the exercises for your knee, check this video here.